Good afternoon. I'm Rian Towers from the University of Glasgow, and I'm delighted today to introduce Dr. Ida Kolev, who's the recipient of the 2015 Excellence Award from the Council on Hypertension. So welcome, Dr. Ida Kolev. Perhaps you could tell us a little bit about yourself and where you're working, and of course the important work that you're doing that has actually allowed you to be the recipient of this very prestigious award.
Thank you very much. I'm really delighted to have been given this distinguished recognition, especially in light of the people who have gotten before me, who I don't feel like the same level, but I'm nevertheless very happy to have received this award. I'm a director of the Brain and Mind Research Institute at Weill Cornell Medical College, which is a basic science department that works on a wide variety of disease-related issues concerning the brain. And I'm a neurologist by training, and I also did throughout my career, extensive research at the bench. So I can be the so-called clinician scientist that everybody is talking about. And I've been always, attracted to clinical issues that can be dissected and studied at the basic science level with the intent one day to come up with some treatment that may help patients.
So I know that you're working in a very important area of research. Perhaps you could tell us a little bit more about the specific area that you're working in related to the vascular dementia, the Alzheimer's, and this whole new field of the gray zone between all these different types of conditions.
Yes. So my training was really in the normal regulation of the cerebral circulation. So I always had an interest in blood vessels and the brain. And my first foray into disease was studies in ischemic stroke, which still we have a big interest, particularly with respect to the immunology of stroke. But in the 90s, after I moved to the University of Minnesota with my first real academic job, I happened to be next door to a brilliant Alzheimer's scientist who had just come up with the first real mouse model of Alzheimer's disease. And because I'd helped her with some experiments, she offered me to use the mice. And I never used mice before, because as you know, this was like the early 90s where we were all using rats.
Right, yes, of course.
And so we, with the help of my wife, Betsy Ross, who's an MD PhD also, who was a molecular geneticist, I was able to kind of understand a little bit better about transgenics and what it meant and how to distinguish them and things like that. And then just for fun of it, I started to look at vascular regulation in these mice. And I found unexpectedly that these mice, who are supposed to have a Alzheimer's-like pathology, had a profound dysfunction in the regulation of the cerebral circulation. At the time, this was really anathema. It was even the Dr. Shao didn't believe it. And she reluctantly agreed to be on the first publication. Perhaps because it was in Nature Neuroscience.
Oh yes, I'm sure.
But then, the data started to come in, and there were like several lines of evidence. One coming from the epidemiology, suggesting that Alzheimer's patients have the same risk factors as stroke patients, suggesting there must be something going on in their vessels that somehow relates to Alzheimer's, to the Alzheimer's pathology. And then studies in humans have show that patients with Alzheimer's disease had a profound reduction in blood flow to the brain, even before they got demented. And so the idea became more and more accepted. And so we, after getting funded from the NIH, we continued aggressively to that area of research. So, and then, upon my return to the university, this was at the University of Minnesota, upon my return to Weill Cornell, where I was a postdoctoral fellow in the neurology area, I was supposed to kind of take over a program project from my mentor, Dr. Donald Rees, and one of the most undervalued, researchers. He was really a great creative force in this field. And so I began looking at hypertension in the brain, and particularly with the vascular regulation, which was my area. And I discovered that essentially hypertension was doing the same thing on the blood vessels of the brain as Alzheimer's disease.
Right. So there's tremendous interactions between all these, I guess, comorbidities or risk factors or etiologies, perhaps having very similar basic mechanisms at the end of the day. So this has really become a very exciting field of research for you then, understanding the vasculature in the brain and all these conditions. And we know today that vascular dementia and Alzheimer's is such an enormous societal, health and economic burden. Is there any hope for new treatments? Do we understand anything more about the mechanisms, the hard work that you're doing? Can you tell us a little bit about what you think in terms of the future?
Sure. I think, Alzheimer is not a vascular disease, but Alzheimer is influenced by vascular risk factors that can kind of cooperate with the genetic alteration in Alzheimer to enhance the manifestation of the disease. So it's a coadjuvant to the process, but an important one. And there is a recent study, meta-analysis, shows that if one would control the vascular risk factors in Alzheimer's disease, that is diabetes, obesity, hypertension, the incidence of Alzheimer's disease will be reduced by 30%.
That is.
Which is a remarkable, now that data obviously relies on meta-analysis of different trials and so on. But I think there is no question, as shown by a recent study done in Scandinavia, that really controlling the vascular risk factors, maintaining the mind active, is going to have an impact on reducing the incidence of Alzheimer's disease. That's from the cardiovascular standpoint. The other aspect is that there is an increasing success of treatments to reduce the chemicals that accumulate in the brain of Alzheimer's disease, called the amyloid beta peptide, which is thought to cause all the troubles in Alzheimer's. And there was a recent study by Biogen, a pharmaceutical company, demonstrating that administration of antibodies who kind of attach themselves to this amyloid substance are able to reduce it to make the patients better. So in the end, Alzheimer's, treatment is going to depend upon multiple factors. So on the one hand, we're going to have to maintain the health of the brain by controlling vascular risk factors and maintaining the brain active and so on. At the same time, we need interventions that are able to kind of reduce the burden of the amyloid in the brain. This multiplicity of approaches, which is really novel. Because Alzheimer, until 10-20 years ago, was considered purely what we call neurodegenerative disease. So disease of neurons. Now we know that the neurons are just the target of these deleterious effects, at the end results of this pathological process, which, however, is initiated in other cells in the brain. And so all the cells of the brain needs to be taken care of in order to improve.
Well, I think we've still obviously got a lot to discover, and I know we're in the very best of hands in terms of the work that you and your group are doing, and I really thank you for sharing with us some of your thoughts related to your research. And once again, on behalf of the Council, all the very best and congratulations on the award for this year. Thank you.
I'd like to thank you for this nice, kind word, and also I'd like to thank the American Art Association who gave me my first grant.
Well, there you go.
So really
it worked out well, and I'm sure the American Heart Association is certainly very proud to know that the grant that they gave you so many years ago has held you and many other researchers in good stead. So thank you, Costantino.